Hello, in this video we're going to discuss Medicine Part 5, Psychology. So there's been a huge disappointment with this field of medicine in regard to humankind. So from heaven's perspective, literally most psychologists wind up in purgatory and wind up suffering immense punishment for offences against humankind. So firstly, we'll look at the only two diagnoses that you psychologists are permitted to give someone. The first one is unhappiness, right? Not depression, unhappiness. So if someone's unhappy, you talk to them and you find out what the problem is, why they're unhappy. The second diagnosis is post-traumatic stress. Again, you talk to the patient, you find out what happened, and you help them get over the trauma. Right? You do not do anything else. And that's where we have a problem with you. So everything else, 100% everything else, is fake mental illnesses. We'll look at schizophrenia. In the case of schizophrenia, you're saying a person believes that they can hear voices. In regard to this, there's always drug and hypnosis involved against the victim. They always have a handler. Often the handler is in the room with the psychologist. Okay? And the handler is responsible for that person being like that. The handler whispers in their ear, the psychologist can hear it. And then the person who's the victim tells them. Alright? So that's where those voices come from. They don't come from nowhere, they come from somewhere, they come from a handler. Modern day technology, they can insert a microphone, speaker in a person's ear and do it wirelessly, in which case you're looking for an offender. Alright? So schizophrenia, fake mental illness. There are many others. Tourette's is a fake mental illness. There's a handler involved. They drown out and hypnotize the victim. They have a trigger word which causes a antisocial response. Alright? And again, the handler's in the room talking to the victim. They primarily target children with this. Asperger's syndrome is another fake mental illness. Alright? So, the only two diagnoses, unhappiness, post-traumatic stress. There should be no restraining of the patient at all. It should be done. You should be communicating with them and finding out what the problem is. That's when this technology was brought to earth. That's what it is. In order to help humankind, the actual treatment was completely ignored. And so now we have problems with psychologists in purgatory. They get hammered big time. Alright? So if you commit the offence of fake mental illness against a patient, you'll wind up in purgatory. So 80 years getting whipped continuously. Okay? So later on you will get prison in regard to schizophrenia, because it'll come up that you knew the handler was in the room talking to the victim. All this will be brought out into the open, and full investigations will be conducted with the police, and the handlers will go to prison, and the psychologist will go to prison for being in on it. Okay, so we've got to sort things out in regard to this, or quite simply, in a harmonious society, you might not be considered responsible enough to do this sort of work. Alright? And be left to heaven to conduct it. All right. So there's no injections, no medications. You shouldn't be medicating people. You shouldn't be restraining patients. You shouldn't be imprisoning them. You shouldn't be detaining them in any way, shape, or form. You just talk to them, find out what the problem is, and that's how you address it. I'm the Archangel Daniel, and I'm from heaven.